Erectile dysfunction is exactly what it sounds like. It is a lack of adequate performance with an erection based on a male patient satisfaction. Erectile dysfunction is extremely common. It can affect approximately 40 to 50% of men as young as 40, with the percentage likelihood increasing as we age. Erectile dysfunction is what we call multifactorial, meaning that there are several different items that can contribute to it. Among these include medications, age, previous surgeries, lifestyle problems, and a variety of other concerns as well. Erectile dysfunction is most typically diagnosed with a patient presenting with symptoms consistent with a lack of erectile performance. Blood testing and possibly some imaging can be performed afterwards to confirm this. Erectile dysfunction can be prevented in some situations, but a majority of erectile dysfunction is not a preventable issue. And once erectile dysfunction presents, turning back the clock and moving in a direction where it lessens is often not possible. Many primary care doctors are well versed in prescribing medication for erectile dysfunction, but that's really the tip of the iceberg when it comes to what options there are to treat ED. So seeing a specialist for ED basically allows a patient to have access to all of this other types of therapy. Treatment options for ED vary. Initially, lifestyle changes and behavioral modifications might be utilized, as well as potentially looking at the factors that are forming it and addressing those factors. But if those are not helpful, some of the more focused treatments for erectile dysfunction include oral medical therapies and possible directed medical therapies to the penis, as well as a variety of different external and internal pump options. In determining what treatment is right for an individual, finding out where that individual is coming from is the most important factor. Not one treatment is the right treatment for every single person. And it's that type of individualized attention that most benefits a patient coming to see a specialist for ED treatment. Satisfaction rates typically vary. For many men, medical therapy is unsatisfactory because while they might get some degree of response, they're not getting a response that they enjoy. And satisfaction rates are based on our overall enjoyment as men of the sexual act. So as you move through the different types of therapies, when something works, obviously it's going to be satisfactory. The beauty of surgical intervention, although that doesn't apply to every patient, is that surgical intervention has a remarkably high satisfaction rate, with rates consistently over 90%. Erectile dysfunction can contribute some significant psychological consequences. Many patients react with some depression. They notice that their life is changing in a way that they don't appreciate. Some people do describe relationship issues. It is a very significant issue, and it's an issue that's often not addressed socially. So men feel a great deal of burden on their own shoulders, thinking that they have to handle this issue by themselves.